Hello everyone, welcome to the video on GPAT 2022 Crash Course MCQ series. In this video I am going to explain about previously given GPAT pharmacology questions with answer explanation, and this is part 8. I have already made 7 parts of previous GPAT pharmacology questions with answer explanation. Please do watch my channel. And this is my channel wherein you found all pharma related content. If you like the contents, do subscribe, share the video. Let's get into the topic. Now, which of the following drugs are found in both prescription and over-the-counter nasal decongestants? So, these drugs can be given in prescription as well as over-the-counter, and they are nasal decongestants. Now, the popular nasal decongestants are alpha-1 agonists like nafzolin, xylometazoline, phenylephrine. Especially phenylephrine is found in many of the cold tablets like Coldact and all of them. So phenylephrine and all these things, they cause vasoconstriction. Because of that vasoconstriction, the congestion or mucus formation is reduced. That is how they act as nasal decongestants. So option B, alpha-1 agonist, is the answer. Now see, remaining choices are not correct. Alpha-2 agonist, alpha-1 antagonist, beta-2 agonist, all of them are wrong one. Now getting to the next one. Now, methenamine used for urinary tract infection is a prodrug. How is it converted into? Now, this prodrug is converted into active form. At urine, it has got a kind of low pH. Low pH means acidic pH, and it is converted to formaldehyde. Now, formaldehyde is the one which is acting as urinary tract disinfectant. It is used to treat urinary tract infections because of the formation of formaldehyde, and it forms only at low pH of the urine. So option A is the correct one. Moving to the next one. Now, which of the following depolarizing neuromuscular agent is effective in treating pinworm? See, option A, pyrantel palmiate, the mechanism of action is it is a depolarizing neuromuscular agent, because of which it causes muscle paralysis, and this pinworm infection can be treated. See, all these worms will be attached to the intestine. When muscle paralysis occurs, they will fall down and go out of the body through the feces. That is how it treats it. Now, paromomycin, you all know it is a protein synthesis inhibitor which is related to aminoglycoside category. Now, praziquantel, it increases permeability for calcium in these worms. So what happens with that, severe contraction occurs, and these contractions will also result in paralysis. That is how praziquantel acts. Now, ivermectin increases gamma aminobutyric acid transmission, and it affects neurons as well as muscles. So this is how it will act. So in this case, the option A, pyrantel palmiate, is the answer. Moving to the next one. Now, oseltamivir inhibits which of the following enzyme? Now, oseltamivir, zanamivir are used to treat influenza virus. They are used to treat influenza virus, and they will be inhibiting a viral enzyme called as neuraminidase. Now, this viral neuraminidase is responsible for the viral spread. When the virus develops into variants in cells, its spread occurs because of this enzyme neuraminidase. And oseltamivir and zanamivir will inhibit this particular enzyme. Option B is correct. Now, which of the following antibodies are involved in hypersensitivity reactions? Now see, there are 4 types of hypersensitivity as are there, 1, 2, 3 and 4. Now, out of this, the first hypersensitivity reaction occurs because of IgE antibody. The next 2 and 3 are because of IgG and IgM antibodies. Whereas type 4, it is because of T cells. So T cells. So when you see the hypersensitivity is IgG and IgM are involved in both the types of 2 and 3. So option B is the correct answer. Moving to the next one. Now, which is the first line drug for the treatment of generalized seizures? Now, the best choice to treat generalized seizures is sodium valproate or valproic acid. See, all the remaining drugs are also anti-epileptic drugs, but the first choice of drug is valproate or valproic acid. Moving to the next one. Which of the following condition is treated with benzatropine? Benzatropine mesylate is an anticholinergic agent. Now, this anticholinergic agent is used to treat Parkinson's disorder. What happens in Parkinson's? In Parkinson's, dopamine levels are decreased. Now, there is a smooth balance between dopamine and acetylcholine in nervous system. When dopamine levels are decreased, increased effects of acetylcholine will be there. So, to control these increased effects, anticholinergic drugs like benzatropine is used. So option A, Parkinson disorder, is the correct option. Moving to the next one. Now, phase 0 studies of clinical trials include which parameters? Now, phase 0, they are known as a microdosing study. Usually, see, we have preclinicals and clinical trials are there. Now, between these two, you get phase 0 studies. In phase 0 studies, the toxicity of the drug is determined, and it is conducted on very less population, 10 to 15 volunteers only. And the basic job is to find out the toxicity. So very small dose is given, because if it is of toxic in nature, it will cause death in human being. That is why microdosing is there. Next one. Timolol, if administered ophthalmically, then which effect it will exhibit? Now, timolol, all of them related to beta blockers category. They are beta blocker category. Now, beta blockers, one of the major job is they decrease the formation of aqueous humor in the eye, and that is the reason they are used to treat glaucoma. In fact, timolol basic use is to use ophthalmically to treat glaucoma. What happens in that? It decreases aqueous humor formation. Going to the next one. Now, what is the main product of purine metabolism in humans? Now, purine will get metabolized and it gives purine will get metabolized and gives uric acid. Now, the final product of purine metabolism in human being is uric acid. Now, the problem with uric acid is increased levels of urate crystal is what causes gout. Accumulation of these crystals at the junctions will result in gout disease. So, the purine metabolism excess will form uric acid. Now, what is nafazoline? We have already seen it. Nafazoline is used to relieve nasal congestion, and it is an alpha-1 agonist. How does it act? It acts by causing vasoconstriction. When the blood vessel is constricted, mucus formation is reduced, and that is how it can be used to treat congestion. Now, next. Mechanism of bacterial resistance to sulfonamide. Now, the sulfonamides, all the sulfur drugs are structural analogs of para-aminobenzoic acid. Now, bacteria uses this para-aminobenzoic acid to synthesize its folic acid. So, what happens? All the bacteria will get affected by sulfonamides because it inhibits or interferes with para-aminobenzoic acid in the formation of folic acid. So, what happens? How bacteria acquires resistance is, it develops an alteration in the enzyme that utilizes para-aminobenzoic acid, and because of this, sulfonamides will render ineffective. So, option A is the correct answer. Into the next one. Now, what is clavulanic acid? Now, clavulanic acid, it is a potent inhibitor of peptidoglycan synthesis. No, it inactivates bacterial beta-lactamase enzyme. Now, clavulanic acid, the mechanism of action is it inactivates bacterial beta-lactamase enzyme. In fact, clavulanic acid is usually given along with amoxicillin. The combination is known as augmentin. Amoxicillin is an antibiotic, but it is susceptible to beta-lactamase enzyme. So, the enzyme is inhibited by clavulanic acid. So, clavulanic acid, sulbactam, tazobactam, all of them, their mechanism of action is they inactivates bacterial beta-lactamase. Moving to the next one. Now, a patient using warfarin develops rheumatoid arthritis. Which of the following would be contraindicated? See, to treat rheumatoid arthritis, NSAIDs are used. All these three are NSAIDs, and this one is very selective drug to treat rheumatoid arthritis, a gold compound. Now, out of this, which one is contraindicated? Means aspirin is contraindicated. The reason is warfarin. Warfarin is an anticoagulant, aspirin is antiplatelet. So, when these two are given, they increase the susceptibility for bleeding and they cause severe bleeding disorders. That is the reason why this drug-drug interaction will occur, and it is contraindicated to use this. So, patient using warfarin who develops rheumatoid arthritis should not take aspirin. On to the next one. Which of the following is used for the management of complicated malaria? Now, in 2012, World Health Organization started recommending artemisinin to treat complicated malaria. Artemether, artesunate, both of them are there. In fact, artemisinin can be given with other drugs known as artemisinin combination therapy. Multiple combinations are used. But for complicated malaria, this is the choice of drug, artemisinins. So these 15 drugs are given in the previous GPAT. Hope you like the class. If you like the class, share the video, subscribe the channel. Thank you for watching this video.